What brought you to this endeavor?
I had a very challenging health issue that occurred. I was going about my daily routine. I thought I was doing great. I went in for my annual checkup, got blood work done. Doctor said I was doing great. And 3 weeks later, I had a significant gout attack. That's when you had told me, well, actually, if you look at your blood work, actually, that was done 3 weeks prior, actually, it shows that, the different markers here show that you're at high risk of getting gout.
Having seen this so many times with patients where I have a personal interest in understanding the whys on the data to objectively figure out that what's really going on here, because we might be missing something. And as a physician, I have a responsibility to be like, I need to objectively look and see things beforehand before this person, calls me at like 2 a.m. and says, Doc, I'm having a massive like chest pain. And I'm saying go to the ER. And they are maybe having a heart attack, or maybe they're having a pulmonary embolism or something's going on. I feel responsible to say, what did I miss it? And I think that kind of was this impetus that we felt that, yes, we would have appreciated it if there had been a tool that would have helped that physician and many other physicians. But that also, as patients and as family members, we also want to feel empowered to be like, I want to understand what's happening and I want to take those actions if I just knew.
Yeah, it was definitely the gout attack. I don't remember feeling pain like that before. And just feeling stuck and saying, well, wait a minute, this is happening to me, it's happening to many others as well. And if this is actually preventable, why are we not looking at the data and the science that's there and helping others to prevent this exact issue, as well as cardiovascular risk, a whole host of other areas? It's then when I realized that 90% to 95% of the issues in the US are chronic issues that are developing over time. And we are not set up for that here. We are amazing at acute and emergency care. So much so that I would argue we're best in the world at it, most likely. However, that's a small percentage of the issues out there. The vast majority are these chronic issues that continue developing. And as much as we may talk about preventative medicine, or we talk about broader healthcare, precision medicine, how much of that's actually being practiced? How much of that is actually being informed? How much is empowering the patients to better understand, take ownership of their own health, if not only for themselves, for their loved ones, their families? And I realized that there really is a very big opportunity here, because I think this is one of the biggest impacts that happens to any of us. It's our own health and our family's health and how we take care of them. And so as we saw that not only with your father, my father, and with other loved ones, and myself, realized, wait, we have an opportunity here to provide a lot of good to people if we can just explain the most objective data that's out there, which is the lab results that come back. There is no symptomatic, hey, wait, how much pain threshold does one feel? Instead, it's no, here's what the labs are saying of how well the body's doing and how the health is inside. And if we can show that and just make it objective and drive that, then people can understand it for themselves at every step along the way here.
So, where do you think data and technology are heading relative to healthcare?
The exciting element in healthcare is that we are seeing the highest level of receptivity towards technology solutions to help augment medicine and healthcare overall. And it's helping in every aspect. Yes, there are administrative tasks that can be more effective, clinical areas that are now becoming new focus areas. And with all that, the idea is, how do you help accelerate the process for everyone in the healthcare chain, whether it's the MA, it's the receptionist, it's the nurse who's taking the vitals, it's the physician who's seeing the patient, everyone across the board, as well as the patient who's becoming more and more educated about their own health symptoms overall. And as part of that process, technology is a big part of that sort of educational piece, as well as insights piece to drive there. Now, there's a lot of focus on artificial intelligence and all the benefits it can provide. And I think many of them are actually gonna have profound impact within medicine. But the one thing I will say is, and I agree with a lot of the AI researchers out there that say that the one thing that AI cannot do is actually reason. That's where human thought differentiates us relative to whether it be automated systems like AI or other animals. And in that process is where we need to find that right balance to say, where are the tools that can help with the decision making and clinical planning as necessary?
I think that just to add to what you said, which is the benefit of technology in clinical medicine is that we have been in an era where we are data overloaded. And we are going to embrace technology in terms of how to understand the data objectively, where it's standardized. And so it's not that if you're seeing Dr. A versus Dr. B versus Dr. C, everyone can take that same data and their perception of the data and how to interpret it and what to do with it can be completely different for the same human being. What I see in the future is that now when accuracy of how to look at the data objectively and understand what does this data say and what should I do about this data, the uniform across many different providers being able to extrapolate that information for this person and say relatively the same thing is going to have a profound impact on both the patient being better informed. It is going to shift more accuracy in the actual treatments that are given, which is going to drive better clinical outcomes. And when I say clinical outcomes, that means that the patient is recovering from either an acute ailment getting resolved or a chronic state starting to reverse. Number two, it's going to actually decrease the amount of time that people are spending trying to figure out what's going on, right? When you either miss a diagnosis or you didn't know what the exact focal point that you should have focused on it. So you're going to decrease time. Decreasing time means you actually are going to benefit the patients because patients don't want to be seeing lots of people. Number two, clinicians are also burning out. They really are trying to do the best job possible, but we need to recognize that we have and will continue to have an extremely high burnout rate across many healthcare providers. So we want to address that head on. The other part is financial. If you can give the clinician and the patients most value, you actually can drive better returns economically for everybody. Where providers are getting more value, they may actually because the value of their work is going to go up because we know insurance reimbursements are going down and patients are saying, I'm paying the same amount, right? That downstream, actually, I think economically, we're going to see quality of care improving, costs getting kind of mitigated, and people actually benefiting across the board.
While technology can be a leveling field and help everyone in the ecosystem, there's a couple areas I think we want to highlight. The data and the insights we can provide based on the individual is very different than how we look at population curves by country. We have much more diverse populations in every country, especially the United States. And here in the US, when we say, yep, does everyone fit that population curve? We know 42% don't. I just want to show the stark difference between medicine and IT. What do I mean by that? In medicine, the process is get the diagnosis as efficiently as possible, and then here's the treatment plan. The diagnosis very often is, okay, what's the primary issue? That's it, let's focus there. In IT, if we face any sort of failure state, as what someone's going to see an issue on the medical side, we're not just saying, okay, what's the issue? We're going to run a standard root cause analysis on it. That root cause analysis is usually very basic IT terminology, a 5 whys analysis. Why did point A happen? Well, it was B. Well, why did B happen? C. Why did C happen? D. Why did D happen? E. That's when we figured we've gotten the root cause of why something transpired. Medicine, as much as it tries to do that to get to the diagnosis, it's such a volume-driven game, unfortunately, that it becomes difficult to do that broader analysis in the clinical practice. And that is where we're able to help bridge that gap by surfacing that sort of the 5 whys analysis on the IT side. See, how do we apply that in clinical medicine? Because on the academic medical side, there's definitely research into that, the root cause analysis. But then how do you bring that across and turn that into practice on the clinical medical side? And that's what I think a big focus of what we're doing is.
So where did you start?
We started by first understanding, is there an opportunity here or not that can be meaningful? And so the first place I went to was, let's go talk to a number of different providers out there, a number of different clinicians, physicians, nurses, nurse practitioners, and understand the process they went through. And by going to almost 70, 80 different clinics, both inpatient as well as outpatient, a wide variety of different disciplines, expertise areas, we started digging into how does this process work today? What are the insights that are developed? What part of the process? How do you look at the broader picture? And what works today in the system? And what are their biggest complaints? What are the biggest issues? Where are they spending their most time? And as part of that, said, okay, how can we help in these processes on the clinical side? So that's the first place to start. And we came to a recognition that lab diagnostics are critically important and objective pieces of data that help drive the entire process. They're arguably amongst the most valuable because of that. And they're definitely the most ubiquitous. And so that was an area we looked at and said, can we do a better job helping the triage, the interpretation, the quick scanning by the physicians before they see the patient along the way? And that was the first thought that came to mind. But then after that, we said, can this actually work or not? So the second part is we said, okay, let's understand what all the research looks like out there. What's the current process? What do the normal ranges look like? What's the process come back to the major labs? Not only the US, but also globally, how's that process play out? And as part of that, is there an opportunity to augment this to provide more insights overall of what all that data is showing? And that's where we looked at a whole host of medical research with a large medical advisory team to pull together and say, what is all that research saying? And how aligned is it with what every country's sort of popular ranges are? Is it 100% aligned? Is there some discrepancy? And how do we look at this broadly as a spectrum, not just as a binary, yep, this value is good, and now all of a sudden you're outside of the normal limits, you're now bad. Usually, what we saw at least was that people are scanning the results and looking for the most egregious outliers. And then based on that, using that to drive, okay, this is what the lab results say. Let's go back to the symptoms and the patient history to understand what transpired here. And our goal was saying, well, wait a minute. If we can understand this broader picture on the diagnostic side, run the medical cabinet, surface that information, it can enrich that information such that it's much more valuable to the clinician who can then put the two pieces together much more readily. One of the interesting factoids I just heard was with a Mayo physician who basically said that 80% of the diagnosis that he saw come through were either misdiagnoses or errors of diagnosis. And I was surprised by that initially. But then when I dug into the data and looked back at retrospective longitudinal studies, realized that a lot of cases end up like that, where the initial or the secondary diagnosis may not be, quote unquote, the most precise one. And eventually they got there. And the reason I bring it up is when you think about morbidity, comorbidities versus mortality, yes, the mortality element says, yes, you're able to avoid mortality. Great, very important. But the morbidity issues, the quality of life issues, unfortunately, are still impacted.
So what does this look like in 20 or 30 or 40 years from now?
In 30 years, we're going to see a completely different medical system. We recognize that acute care is going to continue getting better and better, as we are in the US today. We'll keep improving. But the focus will have to be on chronic health issues. Let me just add that the level of information asymmetry between medical providers and patients is going to continue decreasing over time. And on top of that, the level of self-empowerment for each patient continues increasing as part of that. And so when we look at that, those two dynamics in particular, you start saying everyone feels empowered to be more attuned to their health, but also then address issues earlier. So I think we'll see a major overhaul in the broader healthcare system.
Dr. Bhandari, I have a question for you. What does your day-to-day look like in 30 years from now in that context?
30 years from now, well, realistically, I don't think I'm going to be practicing clinical medicine based on my age. But if I were to imagine someone who is entering medicine today, like
As sentient being may still be practicing medicine.
that I believe a couple things. Number one, that the healthcare practitioner is going to be doing predominantly more virtual visits, that they are actually going to be what they're talking about and how they engage with the patient is really going to be different, where it's not just like pharmaceutical based and like this procedure getting them to a specialist. It may be like that, and because patients are saying, well, doc, what about what I'm eating, or what about this happening? The time I spent with patients may still be short, right? But that's okay, because the patient's saying, that's fine. I have all of these other resources, and as a physician, I would actually be happy connecting and talking to all of those other support teams, right? So that patient actually becomes the main expert of their story, and we all support that process, and we're learning and teaching each other. So I think that this hierarchy is going to change to more equalizing, where you really start enjoying what you're doing, and that you're excited about, yes, this is why I went into medicine, right? That it's revitalized. So I think in 30 years, things are going to be I think they're going to be really different, but in a good way.